myself Dr. Anjali, Faculty of Physiotherapy Department, RPIIT. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, kindly like, share, subscribe the channel.
Next is the active range of motion. It is the arc of motion which attained by a subject during unassisted voluntary joint motion. It provides the examiner with information about the subject willingness to move, coordination, muscle strength, and joint range of motion. Next is the passive range of motion. It is the arc of motion which attained by an examiner without assistance from the subject. Normally, passive range of motion is slightly greater than active range of motion. It provides the examiner with information about the integrity of articular surfaces and the extensibility of soft tissue around the joint. Next, what is the end field? The type of structure that limits a range of motion has a characteristic field which may be detected by the examiner. The examiner should be able to detect normal end field and the abnormal end field. So, normal end field has soft type of end field which occur in soft tissue approximation. Next is firm end field which happens in muscular stretch, capsular stretch, ligament stretch. Next is hard end field which occurs bone to bone. Now we talk about the abnormal end field. Abnormal end field has soft type of end field and it feels bogey type like in edema. Next is firm end field which complete before the range of motion. It occurs in soft tissue shortening or hypertone. Next is hard bony field. Bony grafting, bony block occur in osteoarthritis or loose bodies. Next is empty end field, no end field pain. Pain prevent full range of motion, happens in inflammation. Next is hypomobility. It decrease in range of motion. Hyrex proposed that pathological conditions involving the entire joint capsule cause a particular pattern of restriction involving most of the passive motion of the joint. This pattern is called a capsular pattern. Restriction caused by condition involving structures other than the entire joint capsule is called non-capsular patterns of movement. Non-capsular pattern of movement is not proportioned similar to capsular pattern. Now we talk about the upper joints capsular pattern. First is the shoulder joint or on glenohumeral joint. It restricted the lateral rotation, abduction and the medial rotation. On elbow joint, it restricted flexion and the extension. On forearm, it restricts supination, pronation, flexion and the extension. On wrist, it restricts flexion, extension, lateral or medial deviation. Carpometacarpal digit 1 restrict abduction. CMC digit 2 to 5 all motions are restricted. MCP and the IP joint has flexion and the extension is restricted. Now we talk about the capsular pattern of lower joints or lower limb. On hip it restricted medial rotation, flexion, abduction and the external rotation. And on knee it restrict flexion and the extension. Next, on ankle, it restricted plantar flexion and the dorsiflexion. On subtalar joint, it restrict inversion. On metatarsal or mid-tarsal, adduction and the medial rotation is restricted. On MTP digit 1, flexion and the extension is restricted. MTP digit 2 to 5, flexion and the extension is restricted. On IP, flexion and extension is restricted. Now, we talk about the hypermobility. It refers to an increase in passive range of motion which exceeds normal values. This is due to the laxity of soft tissues around the joint, which causes injury, hereditary disorders. Next is muscle length testing. Muscle length is the greatest extensibility of a muscle tendon unit. It is the maximal distance between the proximal and the distance attachment of a muscle to bone. Muscle length is measured indirectly by determining the end of the range of motion of joint which crossed by that muscle. Muscle length is tested to a certain cause of change in range of motion. Next is muscle length testing are categorized by the number of joints which they cross. It may be one joint muscle, two joint muscle, or multi joint muscle.